Welcome. This module has been designed to raise your awareness of the importance of correct manual handling techniques to protect your body and keep you fit for work. Manual handling is defined as any moving or supporting of a load using only bodily forces. This includes lifting up or putting down a load, pushing or pulling a load, holding or supporting a load, and carrying a load from one place to another. Incorrect manual handling can result in muscle strains and sprains, joint dislocation, tendon tears, and spinal injury, all of which may limit your ability to work and provide you pain and discomfort for many years. Working on a boat is a rigorously demanding job, often requiring handling of heavy bulky items around the boat, including lifting, stooping, and bending. These tasks are often repeated multiple times. The risk of injury is further enhanced on the deck where multiple tripping hazards may exist, where the deck is slippery due to water, fish oil, or slime, and when the boat is rolling or pitching in a seaway. All of these factors need to be taken into consideration in any manual handling risk assessment, and measures should be implemented to eliminate or reduce them if possible. This is where the stop, think, act approach to hazard analysis could be applied. Brian will now demonstrate how you must not lift. No, Brian. That was wrong. Let's break down what Brian did wrong. In this position his back is arched, his legs are too straight, and the load is too far from a center of gravity. From this position we also need to factor additional forces on Brian's body. For example, if Brian positions his upper body over a 10-kilogram load, he will also need to lift the weight of his head, the weight of his upper torso, and the weight of his arms. As Brian lifts the load from this position he barely uses his leg muscles, and his lower back muscles are being used to lift the load and the weight of his entire upper body. These muscles and his lower vertebrae are at risk of injury if they cannot support this weight. We're now going to let Brian try again. This time he will demonstrate the correct lifting technique. Much better this time. Well done, Brian. Let's break down what Brian did right. In this position his back is straight, his legs are bent, and the load is now much closer to his center of gravity. As Brian lifts the load, the weight of the load is almost entirely distributed through the muscles in his legs, requiring minimal, if any, use of the muscles in his back. His back also remains straight throughout the lift, substantially reducing his risk of injury. So far we have looked at how to significantly reduce your risk of manual handling injuries, such as maintaining a straight back and using the leg muscles when lifting. Other options to further reduce the risk of manual handling injuries include eliminating manual handling from tasks where possible, using winches or assistance from another person, avoiding twisting the torso when handling loads, arranging the work environment to reduce the amount and frequency of lifting required, such as storing items that need to be handled at waist height, or using the motion of the boat to help move a load, and only handling loads you can safely manage. You have now completed the manual handling module. Well done. Let's now review the material we covered.